I hate junk food. I mean, why are you eating junk food and not exercising or do something else?
We don't have anything to do.
Wait a minute, there's nothing to do. Whoa, wait a minute now. Let's get everyone together here. Come over here. Come over here. I want to hear this one more time here. You're saying there's nothing to do? That's why you're eating junk food? It's a beautiful day out here, so you should be doing sports and fitness activities. You should get in shape. You should feel good about yourself, not get fat with this stuff. Come on, guys and girls. You can do better than that. Why don't you exercise? Strong, how to get fit, how to get healthy, how to get flexible, how to learn about sports and fitness without any fancy equipment in any big gymnasium, all right?
Students of physical therapy.
But I'm gonna show you now how to whip kids in shape without any expensive equipment or fancy gymnasiums. And you all gonna help me build this gymnasium now.
Thank you, Arnold, for that excellent demonstration on the promotion of community health, wellness, and fitness.
Hello, and welcome to our presentation on the APTA's policies on health, wellness, and fitness. As physical therapists, we are truly qualified to become leaders in health and wellness. The APTA fully supports the positive roles that PTs and PTAs play in the promotion of healthy lifestyles, wellness, and injury prevention. In July 2011, APTA President Scott Ward stated that the APTA stands ready to help Americans live longer and more healthful lives through partnerships at the patient, community, and national level. Previously, in 2005, the APTA adopted a position recommending that all individuals visit a physical therapist annually to promote optimal health, wellness, and fitness, as well as to slow the progression of impairments, functional limitations, and disabilities. Furthermore, the APTA supports providing preventative services in both clinical and community settings, empowering people to make healthful choices and eliminating health disparities. Health and wellness are often interchanged, but the APTA provides specific definitions for use. Wellness describes positive health, exemplified by quality of life and well-being, whereas health is being free from disease, injury, or illness, but it also includes some components of wellness. As we all know from Health and Wellness 668, wellness encompasses these 6 dimensions, as well as others, including occupational, financial, environmental, medical, sexual, and cultural. As future PTs, we need to incorporate these dimensions in our patient and client care. Physical fitness is a dynamic physical state, including cardiovascular endurance, muscular strength, power, flexibility, relaxation, and body composition. Health status, however, is a status of conditions that compromise good health. There are some obstacles to consider pertaining to health and wellness. Not everything that APTA suggests is incorporated in each state. It is important to understand the practice acts in the state in which you are practicing regarding health and wellness. Other obstacles include interpretations of language used and the level of direct access in your state. Here are a few state practice acts, a few of which you may recognize. In Wisconsin, physical therapy means reducing the risk of injury, impairment, functional limitation, or disability by promoting or maintaining fitness, health, or quality of life in all age populations. In Illinois, they use the same language, but without all age populations. In California, the practice of physical therapy includes the promotion and maintenance of physical fitness to enhance the bodily movement-related health and wellness of individuals through the use of physical therapy interventions. Shout out Nick Conti! Some states use language not as clear-cut. Kentucky, Michigan, and Minnesota have verbose definitions and require more interpretation.
In order for us as physical therapists to effectively promote health and wellness, we must first and foremost model the wellness that we're trying to promote. Next, after establishing strong relationships with our patient clients, we're able to teach them how to self-manage their own health and wellness effectively. Physical therapists and physical therapy assistants have a responsibility to counsel their patient clients about healthy lifestyles, as well as educate the public about ways to improve physical activity levels. We can also do this through screening for potential health problems and designing and coordinating activities for them. In order for us to understand our role in physical fitness, we must first understand the population for which we're trying to reach. Physical inactivity is a leading contributor to increased mortality and morbidity in our country, where a majority of individuals don't even meet the basic guidelines. Exercise is good all around, and exercising improves your overall health.
To review, cardiorespiratory guidelines for adults is at least 150 minutes a week of moderate intensity exercise through 30 to 60 minutes of moderate intensity exercise 5 times a week, or 20 to 60 minutes of vigorous intensity exercise 3 times a week. It needs to be continuous sessions or multiple 10-minute bouts. With resistance exercise, we need to train major muscle groups 2 to 3 times a week and do 2 to 4 sets to increase strength and power with 8 to 12 reps and 15 to 20 reps to increase endurance, and there should be 48 hours of rest in between each session. With flexibility, we need to stretch 2 to 3 times per week to increase range of motion. We need to hold to the point of tightness for 10 to 30 seconds and repeat it 2 to 4 times. The use of static, dynamic, or PNF exercises is appropriate. We also want to utilize functional training, and that includes motor skills like balance, agility, and coordination. Also proprioceptive training, and we should do that 20 to 30 minutes a day. The goal of physical activity with children is to get them to exercise 60 minutes a day. It should include muscle strengthening and bone strengthening at least 3 times a week. The activities should be enjoyable, age appropriate, and include a variety of activities.
PT support physical conditioning and wellness instruction for all levels of education. We facilitate motor skill development and promote a physically active lifestyle. We encourage and teach lifelong physical fitness, including aerobic conditioning, flexibility, and strengthening. We also promote positive health and prevent chronic conditions, including obesity. Physical education is an essential component of the education of all children because it provides the opportunity for development and maintenance of physical fitness and motor skills. Wisconsin has a plan called Healthiest Wisconsin 2020 that declares everyone living better, longer. The mission: assure conditions in which people can be healthy and members of healthy, safe, and resilient families and communities. How to get involved? Contact the Health and Wellness Committee of your state or local chapters. Wisconsin's committee is headed by Gwen Straker and Christy Halsey, and they are seeking assistance. If a committee does not exist in your state, create one. We can get involved by getting to know our patients, asking specific questions regarding their health and wellness. We can promote annual visitations to a PT as well. We can seek multidisciplinary care for our patients by forming a wellness team, performing ergonomic assessments, and providing resources in the community. Also, we can promote community events, lead educational classes, and promote workspace wellness.
These are our references. The group will now make their way to the front of the class, in order to answer any questions or entertain thoughts from the audience.